I'm speaking today with Dr. Jonathan Bank of New York Breast Reconstruction and Aesthetic Plastic Surgery Group in Great Neck, New York. He's a board-certified plastic surgeon who specializes in microsurgery, performing implant and tissue-based breast and nerve reconstruction. So, Dr. Bank is a business entrepreneur. I feel that he is, and that's why I had him on today, and a well-published author and speaker. But most importantly, he is a champion in the breast cancer community for women and is keenly aware of the many challenges that we face. And yes, I include myself in that club. He has generously shared his time and expertise on the channel previously. So I want you to check out other videos on this Deep Sea Foundation educational channel and type in the words breast relief system when you go to Deep Sea Foundation YouTube, and you can see the other videos that we have done together. So today we're going to expand our conversation by discussing yet another innovation that Dr. Bank recently shared with me called the Relievver Rose system for post-mastectomy pain relief. And I'm going to add, if you don't mind, Dr. Bank, I'm going to add phantom itching, and you guys will see why as we unfold our conversation. So, Dr. Bank, thank you so much for spending some time with me again after a long day. And I'm going to let you take over and tell us about the Relievver Rose.
Harry, it's always wonderful seeing you. Fortunately, not dashing to an airport as we often encounter each other.
I
And
wasn't going to say that, but I knew you would. So
I have to. It's like it's our thing. That's how we met, and that's how we continue to meet. But
that's exactly, yeah.
this time I was prepared because I knew that on the way to the airport I was probably going to bump into you, and I got to get out of that situation fast. So I remember offloading one of these, which is what we're going to talk about. And I got the heck out of it. And I made my flight in time. And you got one too.
I've
Look at
got
that.
one too. Yeah, so we're going to talk about this today because Dr. Bank, you and I saw each other in October at the American Society of Plastic Surgery meeting in Austin. I think I was coming down the escalator and you took some goofy picture of me. So I got you back when you had your suitcase and you told me not to make you late for your flight. But on a serious note, you very generously gave me the Relievver Rose. Little did I know I was going to use it, but please tell us about it first, and then I'll tell you my little story.
Well, I not only happily gifted you the device, I also intend to gift uh, a nice percentage of whatever we can raise together by selling this to people in need to your foundation with
Thank you.
an additional discount for people that acquired it through your foundation. So, or with the discount code that we'll provide.
Thank you,
Uh,
Dr. Bank. I appreciate that.
I think that the discount code should be Deep Relief. I think that seems right. So
Oh,
DIEPRELIEF.
I like it.
And there's a meaning behind that. And it all stems from me trying to take care of people that have had surgeries for whatever reason, particularly in the breast and chest. And, that's an area that I've dedicated my life to, performing these types of reconstructions of all types, natural tissue, implant reconstruction, aesthetic flat closure. And after some time of performing these reconstructions and talking to people that have had them, in the beginning, we were just kind of focused on getting these things done and then getting them done beautifully. And then
Mhm.
think more about, okay, what are we missing here? And that's where my interest in neurotizing the skin envelope, the nipple areola complex, the flaps, so connecting nerves, or reconstructing nerves that have to be disrupted as part of the mastectomy. Talking to other surgeons in our communities and across the country about procedures to safely preserve the nerves at the time of the mastectomy, and then reconstruct the nerves that cannot be preserved with other plastic surgeons around the country. And the flip side of that same reconstructing nerve coin is what happens to the nerves that aren't reconstructed. And we see that can actually cause pain. That's the chronic post-mastectomy or really post-breast surgery pain syndrome. It can occur after pretty much any procedure on the breast and chest, breast augmentation, breast reduction, breast lift, thoracic surgeries for all kinds of reasons, where the nerves that ultimately end at the skin surface, they somehow get disrupted, whether they're cut, clipped, cauterized, or just stuck in scar tissue and irritated. So the whole breast relief concept that we're talking about is how to approach that as a group with a plastic surgeon at the end when all other non-surgical treatments were exhausted. So physical therapy, which is very, very important before and after surgeries, pain management with pain medications or injections. And then if that is failed, there's surgeries that we can do to maybe explore those nerves and try to reconstruct them after the fact. Now, the real idea is how to prevent that altogether. So that's what I was talking about, how to preserve the nerves and how to manage them intraoperatively at the time of surgery to try to avoid some of these problems, which fortunately, the really severe cases are rare in the single digits percentage-wise. But to a certain degree, in the large studies, and there are plenty of them, I'm aware of at least half a dozen studies ranging from 500 to 5,000 women from various continents on this planet looking at the prevalence of post-breast surgery pain syndrome. And the numbers are staggering. It's up to 70% or so of some degree of that. So the itching that you were referring to, we think that has to do, that's on the very low spectrum of that. It's a nerve that's irritated. It doesn't exactly have a target to grow to, or it has the difficulty growing back, or it's irritated in that process, and it manifests in different ways. The very mild form is an itching or like an occasional zap, and then that can increase to really radiating, burning, electric pain. So
yes, and not to interrupt, Dr. Bank, but I attribute my phantom itching, it's what I call it, to radiation, because it's only the left side that's affected for me. And so,
yeah, radiation, the goal is to affect cells that are problematic, but it does have some collateral damage to varying degrees and can affect the little nerve endings. So that the itch that you can't scratch is a common phrase I hear. I really believe that's can be multifactorial, but at the end of the day, whatever connects to the brain and tells your brain that something's going on, it travels through the nerves. So all that preamble, how to avoid all these things, how to treat them with advanced modalities. Sometimes we don't want to go there. Sometimes we don't need to go there. I'm sure the last thing you want to hear is, oh, maybe let's do a surgery that may help your itch, may make it worse, may cause pain. You don't want that. So I was scratching my head. Well, no pun intended, but that was a scratch itch. And so how do we maybe provide a solution that takes me out of the loop altogether, try to avoid these problems or try to at least calm those nerves down as we're going along. A lot of people are familiar with the TENS machine, buy it at any pharmacy. And it's a little electrode with a little battery and gives little electric pulses. That's an age-old technology, not that age-old. It's 1950s technology, or a concept called the gate theory of nerves. So nerves are almost like smart, but not that smart, electric wires. So the nerves, the way they conduct information, they actually, in the membranes, in the cell membranes of the nerves along its entire course, they're little ionic channels, basically sodium channels, like sodium salt, that open and close. And that, as they open, the sodium channel, sorry, my dog is wagging his tail here in the background. this Chase Bank. If you enjoy dad jokes, that's his name, Chase. As those ions, sodium, potassium, and so on, as they go past the cell membranes, because they're electrically charged, that's how the electricity basically propagates along a nerve. But the channels can only open and close as fast as you can. It's like almost like turning on a light switch. Even if you go really fast, there'll be a little delay, a little
Delay.
exactly.
Yeah.
So, but if you're not really, really quick, you almost won't even notice the light turning on and off. It'll stay on or stay off, whatever. That's basically the concept with the nerves. If you irritate them or you give them a lot of information that they have to respond to very, very quickly, they go into something called a refractory period. So no information is transferred. It's just too fast for them. They're like, I don't know what's going on. I'm shutting down. So that's the concept behind the TENS machine. If you give a lot of pulses, a lot of electric pulses, it's too much electricity to transmit. It's too much information to pass through, and then the nerves just stop. So that can help with all kinds of back pains and things like that. So I thought maybe let's create some kind of a bra that has a TENS unit into it. Let's overstimulate those nerves, distract them, and then maybe that'll just make them go to sleep. So that was the original concept, but fairly quickly I thought that maybe an electric bra is probably not the best idea, and maybe just too uncomfortable, too complicated. So I said, okay, what's the next best thing? Vibrations. They essentially act in a very, very similar way. You're vibrating those nerves. It works in a little bit different mechanism, that the way that pain is transferred along nerve fibers, but close enough to just give that nerve too much information, vibration, that it just stops transmitting the painful stimulations. So I collaborated with my brother-in-law, my sister's husband, who's a brilliant engineer who develops for probably one of the biggest technology companies on the planet. And the other key component was actually a patient of mine. I'm sure she's a friend of yours, as many others. Her name is Dana Donifrey of Anna Ona.
Ooh,
And
the bras I wear when I go to bed at night. Thank you, Dana.
so I thought, who would know better about something that goes on a breast than one of the world's premier post-surgical bra manufacturer, a patient of mine and a friend of mine, who knows this community so well and cares about them so much, and is just a brilliant entrepreneur in her own right. So that was the initial, okay, how do we make this work? So the concept eventually came up to something that vibrates, a tiny little motor similar to what you have in your cell phone that vibrates, in some kind of an encasement that maybe fits into a bra somehow, and a battery that you can charge, because that's important. That has to last a certain period of time and so on. And then we played around with all these weird, I can show you the original prototypes with like a little battery and wires connected around. It was kind of bizarre and freaky looking with all these like very basic, it didn't look exactly very appetizing. But on the first people that I tried on, I was like, oh my God, my pain is gone. You turn it on, my pain is gone. So like, okay, maybe we were onto something here. And then that led to a process that took about 2 years from concept to a box with a thing in a box that I'll show you in a second. That's where we are today with the device we call the Relievver. That it's designed for post-operative comfort. That's what we can say, but it provides help for all kinds of other reasons. And that's that. I'm going to show it to you now. You can take out yours so you can compare. This is the Relievver Rose. It has a nice pinkish color, not too pink. It has a very soft silicone surface that I think is very pleasant to touch. It has a little belly button here in the middle, for a little logo on it. If you can see, maybe. Yeah, here we go. And
yeah,
that's how you on and off.
I'm gonna wait. I'm gonna tell my own story. You go right ahead.
And a little port for charging, just a magnetic charger.
Yeah.
And the has a couple of purposes. So the backing that I have on now, it's It's like a medical silicone, so that'll adhere to your skin and lay it stick on. It comes with the backing on it, so you can just put it in a bra and it doesn't stick. You can move it around as you want. We sell it with a few extra backings that look like this, and you can just paste that on, take it off, and so on. Do with that as you will. Exactly. You can wash this silicone backing. It retains its tackiness, but after, I don't know, several dozen uses, probably loses it a little bit. And that's why we provide the extra ones. You can buy more on the website. So do you want to show us how you turn it on and off and how to use it?
Yeah, I got
Go
to
for
tell
it.
you my story first, though. Um, so I very infrequently get that, you know, itch that you can't scratch on my left side, radiated side. And I've had deep flap for the listeners. I've had deep flap breast reconstruction. But I had radiation 12 years previous to that. So I always say radiation is the gift that keeps on giving. Impacts skin, you know, the underlying tissue, et cetera, and the nerves, right? By the way, that was a brilliant explanation on the nerve pathways. You know, your friend Dr. David Song did a video with me that you can also look up, type in the word nerves. Um, I have kind of geeked out on nerves and the term neuroplasticity between the two of you. I just enjoy learning about it now, mostly on behalf of other patients, but just to understand what's going on myself sometimes. So I get home from Austin, you know, all is well. And I had one of these events. Normally, when this itching starts, it will last for me maybe 24 hours. It hit me one weekend and it literally kept me up at night. And I'm like, what is going on with my breast? So I I was doing this, right? Disrupting the nerve pathways like you were talking about. And I suppose it was driving me nuts enough that the light bulb went off. I was it was in the evening. I'm in my easy chair. You know, my husband and I get all settled in. We're in Seattle, so we had our blankets over us. I think it was November when this happened, maybe December. And I'm like, I can't relieve my itching. And then the light bulb, yeah, ta-da. And I went, okay, I'm going to get out from under my blanket and I'm going to go get that. I plugged it in. It's so easy to charge. I think it's really cool. Okay, let me back up. First of all, I love a good magnetic box. I
Feels
think
good.
that's, I
Like,
think, yeah, I think that's really cool. So I took it out and I'm going to show you guys. I'm not going to reveal anything here because I'll get, you know, YouTube will get me in trouble. But here it is. This is a device. And like Dr. Banks said, there's a port. You just charge it in here. Yes.
magnetic charger.
Yep.
Don't even need
Super,
fingers. Boom.
super simple. And
And the plug it
mhm,
into any USB-A device
yeah.
charger.
So I took this thing. Now, I want you, after I'm done with my little story, to tell us about the app. I did not connect it to the app. I wanted some relief immediately. And I'm like, I'm going to give this thing a whirl. So I just pushed it here. You can hold it down. I don't know if you can hear that because I'm using my microphone. Can you hear that at all?
You can hear it slightly. That's the feedback from the microphone, but basically you can hear a slight vibration.
So I took this and it was so easy. I want you to see how easy it is to slip in to my bra. I turned
And
it
not,
on. I'm sorry?
and not very noticeable.
No. I thought to myself after I had my event, first of all, I put it in there and I'm like, uh, okay, my itching's gone. And why didn't I take this box out the day before yesterday? So it was a light bulb moment for me. And you know that because I sent you a message. Um, but I thought to myself, Dr. Bank, how easy it is, how comfortable it is. I mean, this material is so soft. And if Dana had anything to do with the design and the comfort, I can see where it all came together between the two of you. Um, it was just so easy. I mean, look, anyway,
Yeah.
that's my
So
story. Thank you.
before I go on, tell me, so how long, I know it relieved that itchiness almost immediately, but did it sort of stop that cycle of it? Because usually your episodes, like, they last. Did you feel like it was just, how long did that
It's
take?
once I used this, and I don't remember now because it was gosh, it was at the end of the year, like the November, December timeframe after you gave it to me. I can't tell you how long I had it in. I'm going to say maybe a period. I'm just going to guess, but I think maybe a 5-minute period. And I was like, oh, my itching's gone. And it didn't come back after that. It stopped the cycle. So this, I'm just going to tell you that this helped when I was sitting in the chair, but then I put my blanket back over me and I'm like, oh, here it comes again. So I do this. And then I had the light bulb moment to go get this out. Cute little bag. I forgot to show that.
Have you had to use it again?
I
Did you
haven't.
have to use it?
No, I did not have to use it again. And I haven't had to. Well, I'm glad I have it now in case. But now, I mean, I told a woman about it the other day and she's, you know,
Yeah.
it's in her possession now. I haven't followed up with her, but
Yeah. So, it's been quite a trip with this. And one additional yeah, so Dana helped a lot, not just with always sort of coming up with the idea of the dimensions, the thickness. We wanted it very, very discreet. Um, the original color was a bit too skin tone like, but that's only for one skin tone. We come in all shades of the rainbow. So we wanted something that's hopefully nobody has this colored skin exactly, but
it's a very
um
complimentary color. I made sure I wore something darker today, but you know,
yeah. Um, and then the thickness of it, we didn't want something too prominent. The battery life is critical. You get multiple hours off of this on the full speed, or the full strength, and then with the app that we can show, you can decrease the intensity if you're on. So there are three basic settings. The first setting is what you were showing. It's just a constant vibration. The
mhm.
second setting sort of goes up and down like a wave like that. And then the third setting is like an intermittent pulse up, 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 up. And you can with the app, you can change how strong the vibrations are, the sort of the spacing between the waves of the vibration in that setting and so on and so forth. And you can save each setting for your personal preference. Just go back to the one that you like, the setting maybe we'll create. And then the goal is ultimately to have people able to share that anonymously, study what works for different people. And that's it. Obviously, you should discuss with your doctor, make sure it's safe to use. If you're allergic to silicone or anything like that, or maybe some adhesives, you have to be careful
You
with the
state
adhesive.
that you state that very clearly in the instruction book.
Very simple instruction book,
Mhm.
written with the great help of ChatGPT, but that modified significantly to make sure it's safe for our people. Um, and yeah, that's pretty much it. It's been available since August. We're starting little trials to make August 2024. We're starting, sorry, it's been available since August 2023. And we're starting some trials to see, number one, how people can, if they're having any problems turning it on, turning it off, just make sure it's comfortable. And then we're going to see how maybe it impacts their care. Because one of the nice things that happened with Dana is during one procedure that we did for her, she had one of the prototypes lying around. And after her surgery, she said, time to take a Percocet, but let me just slap one of these things on. She turned it on and she's like, I think I'm going to skip my Percocet. So she did. And that opened up a whole new world of people that can benefit from this. So while it was designed to provide comfort for people that are having chronic post-op issues, I think it's been really, really effective for women recovering and other people recovering from surgery that just happened. So, I'm getting texts left and right saying how much people have benefited from this. So we're very, very excited if this can reduce narcotic intake after that. Nobody wants to go down dependence and stuff like that. And just for these things that we don't have a good solution for.
It's very nice to have alternative choices.
Yeah.
I'm glad to add this to the list for myself and other women too. Did you have some slides you want to share with us today? I don't remember.
Yeah, we can go over a couple of things. It's
okay.
Let me share my screen over here. A lot of things we've talked about already, but start from the top. Relievvr, we're designing this for breast surgery, for post-op comfort, for a gazillion other applications. I just gave it to a friend that got struck in the ribs. That's a really hard one to take care of.
Oh, I know. Again, that's so painful.
You can't put a brace on that. Every time you take a deep breath, the nerves right underneath the ribs are so sensitive because those nerves that go to the breast, they run right underneath those ribs, the intercostal nerves.
Yeah.
And you just need something to distract them. So that's been a lot. Again, we do a lot of breast surgeries in this country. A lot of them are oncologic. A lot of them are just for regular plastic surgery reasons, breast augmentations, breast reductions. And their, pain treatment remains a challenge for patients, whether it's medications and the problems with them, or just other ways to try to avoid cold packs, hot packs. I've seen plenty of cold burns, hot burns from those kinds of things, because the breasts or any skin after surgery, the nerve endings are disrupted and the blood vessels can't necessarily regulate themselves appropriately. That can be a real problem, particularly with implants, but I've seen problems also with various flaps. And the medications that we have now, they have a temporary effect. You got to redose them. They may have adverse effects. People get reactions, allergies, God forbid, addictions. It's obviously contributing to the opioid epidemic. We're going to do whatever we can to fight that. The existing solutions, the TENS units we spoke about, they have their downsides. It's not that comfortable to get an electric shock. Nothing's really built for the breast there. There are lidocaine patches. Those are things that basically patches of numbing medicine that seeps into your system. Usually it's a low dose, but you have to limit the amount you can take because they have some serious toxicities. And then there are other vibratory devices. There are things that are similar for like women that are lactating and their breasts get very engorged, or things for women that have really painful menstrual cycles. But again, nothing's really built for the breasts, and they're all quite clunky, cumbersome, and they don't look like a nipple pasty, which is kind of what we had in mind. I was actually, during one of the prototypes, I was sitting in behind the control desk in front of one of the ORs, and one of the nurses walked by and she's like, "Why are you playing with a nipple pasty?" I was like, "That's a compliment," because she identified this as something that should go on the breast, which is the goal. That the challenge. How do you get this weird electronic device to go on your chest and breast? And that was all right. We're in the right direction. So again, the TENS use is poorly tolerated on the breast. Lidocaine patches, it's a single use. You got to throw it away. There are dosage limits, and the vibratory devices that exist, they just don't fit for the breast. You can't walk around your day with that. You can't go to sleep with the big clunky thing on you. So again, the mechanism of action, we're utilizing the gate theory of nerves and pain. The mechanical stimulation super saturates those sensory nerves. So the pain signals that go to the brain, they're just disrupted. And then pain goes away. So there are basically three components to this device. The internal motor that vibrates, that sticky pad, that adhesive component, and a control mechanism. So there's a little computer chip inside that we can control with a Bluetooth app. Super easy to pair like you pair anything else on your cell phone. One of my biggest success stories, 78-year-old lady. One of my partners said, hey, she has having these pain issues. She's a few weeks after surgery. Can you give her one of those things? I was like, sure. She didn't have her phone with her. I gave it to her. She texted me later. She said, I was able to pair it. So there's no age limit to who can operate these things. And the goal, first goal, empower people to manage or to be an active player in their medical care. So you have a device, you can turn it on and off. What's more empowering than that? It's personalizable. You can change the vibrations to wherever you want. You can save it, you can share it with friends. That's the feedback component. Maybe generate some data that will help get more information to move along to help other women, help other people, help other doctors find another way to treat. And so the features, it has variable patterns of stimulation tailored to whatever effect you want to achieve. You can control it. This is basically what the app looks like. You have you can adjust the strength up and down. You can adjust the pulses duration and the pauses duration in that undulating type. And it's integrated with all mobile devices. So you can control the device remotely, and then we can anonymously store the data. And the circle in the middle, you can't really see it here, but as you sort of change the parameters, the circle grows and shrinks, and then as it works, it's kind of like this mesmerizing ASMR kind of like calming thing to look at. We're still tweaking this, but it's been fun to play with and design. It took me a while to figure out how to design these things. And with my brother-in-law, he just hit some keypads and made it look amazing.
A little bit of a hypnotic feature.
So we're trying to calm all senses here. And then this is just a testimonial of one of my patients. Let me see if this works.
Oh, I love this one. I just watched this.
I was shopping, and I
What'd you get?
What did I get?
Yeah.
Oh my God, I really feel comfortable just inside the other room. Okay. I went to the very common outlets after we dropped my son off at West Point. And I keep the little vibrating thing in my bra at all time.
The Relievvr?
The Relievvr. I leave it in my bra and I turned it on. We were so my husband's like, what's that noise? What's vibrating? And I told him it's me. It's helping me feel better. He's like, all right. Sometimes we'll lie in your bed, he goes, you're vibrating. I'm like, yeah, I'm vibrating. It helps.
Why do you use it?
To relieve some of the pain. It's tight and sore, and I feel like pain across my chest, and it helps. So I keep it in the bra for the day, and I move it around, and I turn it on and give myself a little zap.
I love her. So
Hey, honey, I'm vibrating.
yeah,
I think
So
we
yeah,
had the
that's why-
TV turn up too loud because my husband didn't say, what's that noise?
in a quiet room, you really can't hear it. Some
No.
people, if you're wearing it, that's one of the flaws. That's I think pretty minor. If it's silent room, you may be able to hear it a little bit. But in any other environment where there's just a little bit of ambient noise to even talking to you really can't hear it. When it's totally quiet, totally still, something's vibrating, you're gonna hear it a little bit.
Yeah.
There's only so much you can dampen this because it starts becoming less and less effective. And that's it. It's made out of a soft silicone that it's kind of a balance between, you can't have it too soft because then you can feel the internal components, but we want it a little bit bendy on the edges so it can conform to your breast or chest shape exactly. So it's a little bit bendy, but a little bit firm, and that we have to strike a balance somewhere to kind of maximize all of the benefits and minimize the inherent flaws of any mechanical device.
Well, Dr. Bank, I want to thank you for taking the time to share this with me today and allow me to share my story. I don't know how many iterations you had of this, but this is a good one.
Thank you. There were a lot. I have a little video somewhere. I can show you how he went through all this thing, but
I can imagine. I always
pretty cool.
appreciate your
Super cool.
passion,
I think there were
and
probably,
go ahead.
that's it.
Oh,
There were about 10 prototypes, but getting feedback from our patients,
yeah.
from the people that are actually going to use it, that was probably the most important thing. Says
Mhm.
this too soft, this too chunky, this feels weird, this feels gooey, this, doing all that, and then sort of through still kind of COVID times where you manufacture this, it was an interesting trip, but a fun one. And literally, if it helps one person, then I've done my job. If it helps many, many more, then this can be. I really think it, at least in my practice, it literally revolutionized how we take care of patients. Get one of these. Wow, oh my God. You want to, there's some point after surgery where you kind of want to stop taking medications, but you're still on some, you still need something here and there. I think where this really finds its nice niche in the acute post-op setting. And then for people that have ongoing issues that may not warrant more advanced treatment, it's a really nice sort of active band-aid, so to speak. And sometimes it just stops the vicious cycle like you had in your case.
Yeah, I love that. Thank you so much.
My pleasure.
Thanks for stopping me on the escalator coming down or going out for the airport. I don't remember when it was, but always appreciate your time, Dr. Bank. And thanks so much for showing us the Relievver Rose today.
Thank you, Terry.
Mhm.